Good to see you all. Just like I got introduced, we are a medical metaverse-based innovation platform. I would like to share what kind of projects we're working on. So let's begin. First of all, we work on digital technology to work on medical practicing, which is free from legal constraints or other regulations. So in medical sector, nowadays we're propelling our medical technology, and with SNU's hospital and Severance, Yonsei Severance hospitals, there are many challenges, and we're solving those issues. However, nowadays the earliest field that adopted this was where those clinical trials aren't needed. That is what a lot of people's expectations and projections. So after the COVID circumstances, the medical education field, people say that we have jumped the this field 10 years forward. Like when training medical professionals, the medical national exams have changed, and nurses actual training sessions have changed a lot. So there were a lot of challenge changes. So in the past, a lot of medical professionals had to get 1,000 hours of medical training so that they could get a certificate license. But nowadays, instead of going to school, you can just go to schools and conduct VR simulators to replace them. And also, medical students and other medical licensing certificates, those tests are now computer based. So instead of hard copy paper based tests, they can use computers to conduct tests, so they can interact with each other to test them. So this global solution is showing 14% of growth rate. So then is medical education's challenges. A lot of hospitals are paying a lot of attention here. So based on those clinical training, it's the best to conduct tests on real patients. However, there are privacy issues, so it's very sensitive. So in the past, they used mannequins to conduct their training, but there are limitations to monitor actual their diseases, and there was no interaction. But nowadays, the technology has rapidly increased, so we thought, why don't we use this simulator to change this education field? However, despite the efforts, there weren't many existing programs in the past. That's why many hospitals were saying. So, what differences do we have? Is that first, the medical staff have a lot of patient cases. A specialist say that he or she would learn one or two dozen of thousands of cases. And when we built this game characters, in order to do so, there needs a lot of time to visualize all the different patients. So we thought, isn't there a way to realize this in a easier way? So we characterized this, and we have this auto mapping technology. So on the left, you can see that if you can input the physical input data, then according to the weight, the patient could be slender or fat. Or if you input age, then you can see a patient become young or old, and other input data. So if you input accident information, the severity of the injury, if you input that kind of data, then you can see an injury or wound on the body. So as you can see, so it looks like this patient looks like a zombie because even if he is injured, doesn't look like hurt. So we also worked on neuro system. So if you input like the pain data or consciousness, And if the point is level 3 or level 4, so the patient would show painful reactions among others. So based on this, we databased this so that the system can automatically create patients accordingly. Next, you can't just conduct education just with this patient, so we have to diagnose patients and monitor. So we created this medical clinical skill game, and we modified this mini game. So if you conduct IV to this patient or inject a certain medicine or among other, so you can monitor, run diagnosis, and when you inject medicine, you can see the physical reaction from this status. So you monitor this and conduct actual experience. Next is how to increase the result of this. So through the results, you can see various interaction and accumulate academic data. So based on this data, you can refer to this medical guideline, and based on this guideline, we compare different factors and assess evaluation and provide that. And based on this results report, those students can think about what should have been improved. So when actually those trainees conducted this, when they reach 60 points, which is pass or fail, so many medical trainees kept training this so that they can reach 100 points out of 100. So this has a good positive effect because they can keep training. So in terms of realistic experience, how realistic should it be? So people would think that it's realistic when patients look real. However, medical staff would say that medical responses should be realistic. So this is an overseas case where they filmed an actor here. However, this actor is actually not a patient. So it's difficult to see those wounded areas. And their eyeballs are also just like other ordinary people, not injured people. So it does not identify with identical with patients. So the actual outer appearance is a problem. However, medical people would say that it should be possible to inspect, osculate, and palpate patients. So if someone is like over breathing, then we input this data so that their chest is moving. So every single factor was identical based on our program, so that medical staff can actually practice this. So which should be very close to our real medical practice. So we have this special differentiate characteristics. Next is the difference in playing method. So if you take a look at those conventional simulators, there are so many simulators, and they are based on click and done method. If you inject IV to a patient, then you choose an IV and choose a medicine, so you can administer that. But our model on UBase is very close to clinical trials. So you can see all the medical devices, and you can click and use all the different tools. So you can actually see this IV, and you can see blood vessels popping up. So it looks really real. So far, there's a Medibase platform where you can continue practicing from this model. And next is NurseBase, where you can go to a virtual hospital and treat a patient from hospitalization to getting discharged, thanks to this application. So NurseBase, we are providing this for free for COVID-19 patients, and at our Metaverse exhibition hall. If you visit there, you can experience this VR version for free. The VR version, we launched this platform in January, and the mobile version was also launched recently, and not only at Yonsei Severance University, but Severance Hospital, but also National University, National Hospital of Korea is also adopting this, and firefighting headquarters is also using this platform to evaluate their fighters. And also the satisfactory level is really high. They said 99.7% said they were helpful, and they knew that it was a game, but still they said it was so realistic that they could practice this in a very helpful way. So I'll show you a play video. Please play the video. Does it not play? Well, if it doesn't work, then I'll just move on. Currently, I've been engaged in the healthcare user experience field and our company. We have medical specialists from National Medical Center and also a game designer from Nexon, the online game company. And our team also has a lot of game developers and medical staff who play this game to keep working on this product. And there are many MDs from hospitals or partners with us, so we collaborate with those professionals to develop this game. So this digital simulation education training is something more than those conventional training, but it's not just replacing it, but it's like continuous training of those conventional training. But our ultimate goal is to let them keep training and training, and that so many people can access this medical information. So we want to build this metaverse platform where we can protect privacy of patients. And there are a lot of disparities in this medical field, but we would like to let those developing nations to access developed nation level medical services. So ultimately, we would like to foster an environment where people don't have to worry about legal constraints or medical constraints. Thank you.